Let's see. Next page. This next page gives you a couple vocabulary terms. One talks about derm assessment at the top, and then of course you got a derm assessment at the bottom. If you can see where it says vesicle, I want you to remember there are vesicles on your test. What disease or condition has vesicles?
Cellulitis?
Nope.
Chicken?
Varicella zoster, chicken pox. I mean varicella, not varicella zoster. Varicella or chicken pox has vesicles. Okay, I'm gonna give you another one. If you look at that page, what has pustules? What infectious disease has pustules? That's vesicles. Do you know? It's going to be impetigo. Honey-colored crusted pustules. Now look at the bottom of that page. It continues with derm assessment. And I want you to put on top of the box, malignant melanoma. Malignant melanoma. Okay, so it's very easy. It's as simple as A, B, C, D, E for you to screen a patient for malignant melanoma. If you look at the pictures, I really like how they look, some of them. The first one is asymmetry. It's not a perfect circle like the first picture. It's more irregular border like the second one. Some part of it is raised sometimes. The other part of the mole may be flat. Okay, so it's asymmetrical. If you drew, it says on here, if you drew a line straight through the middle, the two sides would not match. Okay, I think that's a good way to say it. The next one says B for border, and you can see the irregular border. The C for color. Understand that if you have a mole and it is more than one color, that is a red flag. I done seen that in my class. Okay. The diameter. The diameter is a big hairy deal because that will decide whether or not you actually need a biopsy. So we're looking at diameter to tell if you actually need a biopsy. And sometimes I have one and sometimes I don't. I think I have one in here. But I'm going to show you the diameter. I don't think I have one. This is like the diameter of the pencil. So any type 2 pencil, number 2 pencil. The diameter of this pencil is 6 millimeters. You gotta know that. If a mole is 6 millimeters, here I found a better pencil. 6 millimeters, you see the pencil diameter, there's an eraser at the top. If it's more than 6 millimeters, it's gotta get biopsied. Now, that's diameter. Don't forget 6 mm's, not cm's. The next one says evolution. You know what else I want you to think of the E as representing? An eraser, a pencil eraser. So I tell you the E for also eraser because If I take my patients and I'm worried about whether or not they need a biopsy, or you're crazy behind because you've done this to me, come up to me with your little crazy ass mole. Miss Shelley, you think this cancer? I'm going to take my pencil. I'm going to take whatever mole. I have 2 on my shoulder. I don't know if you can see it. And I'm going to put the pencil right over it. If it's outside of the border of my pencil, it needs a biopsy. So I use this. Oh, biopsy, too big. Biopsy, too big. Nah, you're good. You know, whatever. The E actually stands for evolving. And I had a patient the other day that was coming for infusion, and he had just gotten treated for squamous cell skin cancer. And his hand had the area where they did surgery to get the cancer off. It was the top of his hand, like right here. And he had just gotten the stitches out the day before him coming in. And I said, okay, so tell me, how did you know? Because, you know, the top of your hand, who would think of that? How did you know like that was concerning? He said, well, it was there for a while, but then it started changing. Like, and then out the blue, this is all under evolution. So changing. Then he said another type of evolution, change. He said, and then it started itching. And then he added, and then after a while, like it would bleed every now and then with no encouragement at all. Evolution, it's changing, right? Maybe the color used to be brown, now it's gray or blue. Evolution, it's changing. Maybe it never had a hair in it, now it does. Maybe it had a hair in it, now it doesn't. It's changing. Maybe it's growing bigger than it was for years. Changing. Okay? So just remember those. Those are really good for you on skin cancer. The last thing I want you to write at the top of the page, really big. Intact skin is the #1 way to prevent infection. Intact skin is the #1 way to prevent infection. So far, so good. Okie dokie smoky. Now, it says tips on healing skin lesions for your next page. Tips on healing skin lesions. On this page, I'm going to give you how to do a dressing change. Okay? I don't care where you write it anywhere you want to. But before we write it, let's look at the page itself. It says, if it's wet, dry it. If it's dry, wet it. And then it says the most important thing at the bottom. It says to promote healing, use a dressing that will continuously provide a moist environment. Here you go. This is your little golden nugget. Wet to dry dressings are only for debridement. Wet to dry dressings are only for debridement. Now, almost everybody in this room was taught wet to dry dressings. It's all bullshit. You should not be doing a wet to dry dressing because it just told you continuously provide a moist environment. So here's what they should have been called, and perhaps depending on who taught you, maybe that's what they taught you. You need literally wet to damp dressing changes, not wet to dry. Nothing that touches that wound should be dry. Because look what it says, a continuous moist environment. Make sure you know that. Okay? Now, so we're going to get started. You can write it anywhere you want to. Step 1, hand hygiene. Step 2, don, D-O-N, don clean gloves. Step 3. Clean the wound with normal saline. I'm sorry. Nope, I lied. Step 3 is remove the dressing, or how else would you clean the wound? So just remove the dressing. Step 3 is remove the dressing. Step 4, if you have to do it, if it's been ordered, this is when you would get your specimen or culture. So get your specimen or your culture after you remove the dressing. Number 4, or 5 if you had to get a culture. Number 5 would be clean the wound with normal saline from the center to the edge. What number are we on? 6? Mm-hmm. Number 6 is measure the wound. Clean the wound. Number 6 is measure the wound. Remember to use an LWD measuring format. What is the L?
Length.
Length. And length means head to toe. What is the W? Width. And that means hip to hip. What is the D? Depth. Which means dip the Q-tip. So remember the little rhyme. You measure your wounds using head to toe and hip to hip, and then you dip the Q-tip. Okay, so that's how you do it. LWD. Now you're going to remove your clean gloves. Wash your hands. Open sterile equipment and fluids like we just talked about. Then you don sterile gloves. Then you don sterile gloves. And then you cover the wound. Y'all okay? Okay, dokie. On the other side or the bottom of the page, I want you to put